Welcome back, everybody, and we want to welcome back to the Morning Blend from Florida Gulfstream Urology, Dr. Alejandro Miranda Sousa. Welcome back.
Thank you very much.
Let me shake your hand.
Thank you.
Glad to have you back.
Thank you, Bill.
Today, you're here to talk about the prostate biopsy,
That is correct.
those are two words that you probably use as a urologist in your practice when you're dealing with your male patients. Let's start with a little anatomy, if we could. The prostate, what is it? What does it do?
The prostate is a small gland that is situated just under the bladder. It actually surrounds the urethra like a donut around the urethra, and what it does, it produces a fluid to be part of the ejaculate, or the semen, and this fluid will keep the sperm alive and be ready to fertilize the egg down the road. Even compromise around 15% to 20% of the volume of the ejaculate will come from the prostate.
You brought a diagram to show. Let's take a look at this, and the doctor can explain what are we looking at right here.
Yeah, so you see a cut diagram of the pelvis. You can see the bladder, and right under the urinary bladder you can see in purple or orange or pink the prostate. And the prostate, you can see in the insert in the bottom that it has a duct to urinate, and the urine goes through it, and the one on the right will be the one coming from the seminal vesicles. And you can see that continues with the urethra and the penis and then out.
When do
you can see also the proximity of the prostate to the rectum.
Yes,
that's why you can access the prostate very readily through the rectum.
I'm sorry, I didn't mean to interrupt you. I'm curious though. We're taking a look at the prostate biopsy right here.
Correct.
What's
so
going on
what
right
you
here?
see that white instrument is an ultrasound probe. Nowadays, the prostate biopsy routinely is done under direct inspection of ultrasound live images, and with that we can guide and get the biopsy exactly where we want it. If we see any suspicious area, we can also target those, and we can also give a lot of local anesthesia so the patient will be extremely comfortable. Nowadays, that's routinely used, and in the past it used to be done without anesthesia. Now we know where to apply the anesthesia to be doing this process and this procedure almost painless.
Why would you recommend? Why would you say we need to get a little biopsy of your prostate? Under what circumstances?
Correct. So the prostate biopsy is done usually when there is an elevation of the PSA, that is a prostate-specific antigen. It's a protein used in screening for prostate cancer.
The blood test.
It's a blood test, and you have some ranges based on patient's age. When that is off the range, or you can see a steadily increase of the PSA over time, you will be suspected that prostate cancer could be playing a role there, and biopsy might be indicated there. The other difference will be when there is a abnormality felt by your doctor on rectal examination, either your primary care physician or your urologist. The other reason might be if there has been a previous biopsy done and the PSA continues to increase. Sometimes a repeat biopsy will be recommended. And the fourth thing is usually when there has been a biopsy done in the past and there are abnormal cells, not enough to call them cancer, sometimes repeat biopsy will be done.
And the results of that would tell you if there is prostate cancer.
Correct. Usually we obtain between 10 and 12 samples. Those are small needle sticks, they call it core biopsies. And that little segment of prostate that is removed will be sent to a pathologist. The pathologist will look at it under the microscope. They'll be able to see some changes in the cells and see if the changes are enough to call cancer or not, and give more specifics about the cancer if that's present, aggressiveness, characteristics that will be able to guide and personalize treatment if needed, because sometimes prostate cancer doesn't need to be treated, it needs to be observed.
How do you prepare for the biopsy? How do you have your patients get ready?
So usually information is very important to try to calm down the patient. The patient will know what to expect. So we take excellent and extra time to actually be sure the patient understands what we're going to be doing. What they do is they will be having some antibiotics to be taken a day or two before, and sometimes continue afterwards. The patient will have also a fleet enema to try to clean the area of the rectum to have a good visualization and minimize the chance of infection, and will stop any blood thinners, usually between 5 and 7 days, depending on what it is. That will be coordinated with the patient and the primary care physician. Usually.
And about how long does it take to do the procedure?
The procedure is very, very short. Usually could take as little as 3 minutes to be done. Sometimes a little bit longer, depends on the patient, the size of a prostate, and the anatomy itself. But it's a short procedure, 5 minutes within.
And then the waiting time for the results can be?
Usually will be 5 days, 7 days when there are some findings that need to be clarified.
So for the men out there and for the men in your lives, Gulfstream Urology is ready to answer questions and see patients and talk to everybody about these subjects and more, right,
Absolutely.
Doctor?
Absolutely. And, sometimes this creates anxiety. If you don't feel comfortable, come talk to us. We'll be able to provide more information. Hopefully, it will be something that will calm you down and be sure that we're working towards getting benefit of the patient, because we're there for the patients.
You are the picture of calmness and tranquility. Thank you, Dr. Alejandro Miranda
Thank you.
Sousa.
Thank you for the
To find
invitation.
out more about 21st Century Oncology or Florida Gulfstream Urology, just go to our website. That's fox4morningblend.com.
Up next, our condo and HOA law group friends